And then that'll be posted as soon as it's ready to upload. That takes a while. But by supper time, it should be up for you to look at over the weekend. Today, we're going to talk about therapeutic exercise. And you're going to learn that I don't like to lecture necessarily. I actually hate listening to myself talk. So when I can, I mix things up. And so today is going to be more discussion, two-way discussion, than me just giving you information. Okay, so let's jump in with a PowerPoint because that always guides my thoughts. Okay, can everyone see it? Tina, can you see it? Okay, perfect. So therapeutic exercise, this is how this is going to work. We're actually just going to be asking and answering questions that are on your notes. So as long as you took notes and you prepped, you are going to be good to go. Okay. So first one, well, we always look at the objectives, but you've read those. They're at the beginning of the chapter. They're also on the top of your lesson plans. Let's talk about fitness, because fitness is different than therapeutic exercise. Okay. What is fitness? We're going to start with Sky. What's fitness, honey?
Fitness means the capacity to exercise.
The capacity to exercise. So when we say that, what does that exactly mean?
If you're able to stay fit with a program, or just keeping your body up to date without just like letting go. I mean,
there
it's
you go.
okay to give yourself a break, but then again, it's not okay to overdo it.
There you go. So really, fitness is just the capacity really to function, right? Like to be able to get up in the morning, make our bed, whatever, go get groceries. Also like the capacity for actual exercise, like exerting ourselves and pushing our physical limits. Good. That's what fitness is. What can affect a patient's fitness and stamina, Kaylee?
Sedentary lifestyle, health problems, a compromised muscle and skeletal function, obesity, advanced age, smoking, and hypertension.
Good job. So all of those things, let's hit them kind of one by one. So sedentary lifestyle, right, because that will, when someone is sedentary and doesn't have a lot of activity, that will make their heart not very efficient. That, if you don't work muscles, they grow weak, and your heart is the same. So sedentary lifestyle will create a weak cardiovascular system, a weak respiratory system, and a weak musculoskeletal system, right? All of that, just from sitting around and not using the things that we have. Health problems, all kinds of health problems, maybe chronic conditions like respiratory illness, diabetes, heart disease, amputations, GI stuff, all of that can affect our fitness and our stamina. Even psychosocial things like depression can affect our fitness and stamina. We already mentioned musculoskeletal problems, but someone who maybe has a curved back, has an amputee, has muscle wasting for some reason, those are going to cause problems with stamina and fitness. Obesity, it's really hard when you have the wrong makeup of your body. If you've got more adipose tissue than you should, it's really hard to get moving and to create some cardiovascular endurance. It's just really hard to even just function if you're morbidly obese. So usually exercising is really, really hard then. Age, the capacity to exercise decreases as people age. So a 90-year-old is not going to have that same capacity and stamina that a 30-year-old will. That makes sense to us. Smoking really messes with oxygenation, perfusion, so that's why that is really a bad thing that affects stamina. And hypertension, because hypertension will do a lot of damage to our vessels, to our cardiovascular health. So all those things can affect our fitness and our capacity for exercise. Why do we assess fitness before starting a patient on an exercise program? Jessica Beckman.
To see what they're able to tolerate to prevent injury.
Right. So if we don't assess someone and we just say, oh, this is what you need to start to do for your exercise program, we might be either under or over prescribing, right? Because like if I'm telling someone they need to go walk a half a mile 3 times a week and they're a marathon runner, that's not going to help them. So we need to assess that. Conversely, if I tell someone to go run 2 miles and they're me, I might kill them, right? And so we really do need to know where their baseline is to know how to get them improved and what improvement even looks like for them. Good job. Big thing is could result in injury, and then also, or you just don't get any effect at all if you're too easy on your prescription. What do we assess when determining fitness level? What are the things we look at, Danielle?
Can you hear me?
Yeah.
Okay. I read the chapter, but I didn't take notes.
Okay, that's honest. So just follow along with us, and I bet you'll be able to find that answer. We should be in the first couple pages. We're just working our way through the book.
Okay.
So what kind of things do you think we should assess when we're trying to figure out someone's fitness level?
Just like what they're able to tolerate without being exhausted and in pain, I guess.
Good. Good. Yeah, tolerance, activity tolerance is a big one. We also want to look at their body composition. We already talked about fat to muscle ratio is important. Vital signs are important. Here's why. If someone's already so out of shape, they have high blood pressure and high heart rate, their heart's already working hard just trying to function during the day. And if we stress them by saying, hey, let's go out for a walk, that might be really detrimental to them. So even vital signs are assessed before we start to figure out a fitness level. And then fitness tests. There's all kinds of fitness tests out there. One is called the stress ECG. Can someone explain here? Jessica Bell, explain to me what a stress ECG is.
It tests electrical conduction through the heart during maximal activity and is performed in an acute care facility or an outpatient clinic.
Perfect. That's exactly what a stress test is. You'll hear people say, oh, my mom had to go have a stress test. What that means is the provider is concerned that when the body is maxed out, stressed, the endurance is pushed, they have some sort of activity that's above normal, the heart reacts to that in a bad way. It triggers problems like arrhythmias or skipped beats or things like that, or even chest pain. So we can test someone by putting them through the stress of usually putting them on a treadmill and making them get their heart rate up on that treadmill. You're right, it happens in an acute facility because we don't want them coding in a doctor's office or in some outpatient, testing facility, right? We want them where we can actually code them if we had to. That's always not what we want to do, but we want the capacity to do it. Sometimes, though, you've got patients who are not ambulatory, right? Like they're in a wheelchair or they're so out of shape that they can't walk on a treadmill. There's also something called a non-stress test. Non-stress test, the person stays in the bed or on the cart, laying down, and we give them an injection of something like adrenaline to get their heart beating faster. That would simulate the stress of a hard run or walk on a treadmill. Once we get that heart beating faster, just chemically induced, we can see how the heart reacts to that increased demand of oxygen. Okay, so that's the stress test and the non-stress test. Good job. There's also a 24-hour Holter monitor. This also sometimes now we're starting to see where they're extending into 48-hour studies, but for the most part, they're 24-hour studies. This is where someone would go into the office and have an EKG type thing, leads and a little box on a belt put on, and they're going to leave that on for at least 1 day, sometimes 2. The reason that we're doing that is we're not necessarily looking for their response to stress, but just their response to their daily functioning. Okay, so part of the Holter monitor or the 24-hour ECG is that they have to log and track their activity through the day. So when they get up in the morning, they would write down, I slept from midnight to 8, and then I showered. Well, no shower, right? Because you'll electrocute yourself with the wires. So sponge bath. I went for a walk, whatever their activity was. I went to work. I went for coffee. I think that there are people who don't want bad test results. I remember a couple people that literally got this thing put on and then went and sat on their couch for a day. That's not helpful, right? Like, we need to see how their heart reacts just to normal daily activity. So when we get their monitor results back and it records their heart rate for like a day, we can take that and time it against the log and see, oh, she had extra beats every time she walked upstairs, right? It's very helpful to see what triggers bad cardiac things by doing this. But we have to encourage them to just live their life normally, because people don't really want to have a bad test, so they sit still. Another test is the step test. Can anyone tell me about the step test? How about Miranda?
It's a test where you go like up and down stairs for 3 to 5 minutes. And it just, I'm not really sure, I guess, what it's looking for.
Yeah, you got the bones of it, so that's good. So we will have them usually step up and down off of one step, usually like a box, for 3 to 5 minutes, and that gets their heart rate up, right? Well, does a healthy heart recover from activity slow or fast, Miranda? What do you think? A healthy heart, how fast would it recover?
Probably decently fast if it was healthy.
Fast, right? And so this test measures how quickly the heart will recover from that activity. If it takes me 20 minutes to get my heart rate back down to where it was before the exercise, that means that I'm in pretty bad shape, right? But if I stop stepping and then within a minute it's back down to normal, it means my heart and my body recovered quite quickly and that it's pretty conditioned for activity. Good job. How about the mile test? Paula, what's the mile test? Are you with us, Paula? Are you muted?
Right, I am. So you said, what is the mile test?
Yeah, well, tell me about that.
It is time test, walk 1 mile flat surface as fast as possible, compare result with standardized chart, poor fitness or excellent fitness.
Okay, so what did you just read me? What does all that mean? How do we do a mile test in your words?
Basically, you just a time test, walk 1 mile, and basically see how you do in that time.
Right. Okay, and so would a healthy person walk faster or slower?
Faster.
Right. So this is all about how quickly they can move. You know that someone who walks brisk is in pretty good shape. Someone who really kind of drags along is not in good shape. So that's another way to test fitness. Right. Good job. Good job. Good job. All right. So now that I made you guys all tell me, we're going to review them again one by one, because I sometimes think that respiratory, whoa, where did that come from? Repetition is the best way to learn some of this. So let's go through them again, one by one. So a stress ECG, it really looks at the electrical current running through the heart during a lot of activity, like on a treadmill, right? It's performed in an acute facility because of the risk of having a coronary event during this stress. Usually walking on a treadmill, but if they're not able to walk on a treadmill, we can do that artificially with some chemicals and drugs. Okay, so that's kind of the overview of that. The 24-hour Holter monitor, if you remember, that's also called an ambulatory ECG, which means the person's just going to be walking around and living life for 24 hours. And they have to have an activity log, and they're really encouraged to just live their normal life and to not, try to keep things low key. They need to just live normally and try actually to see what triggers their events. The other thing about the 24-hour monitor is with all those leads on, you don't want to go swimming, and you definitely don't want to get in the shower or bathtub. Step test, someone described that real well. We're going to have someone do steps up to 5 minutes, and we're going to take their pulse. Now, I don't care if you know all this. This really doesn't matter to me if you know the recovery index and stuff. I think that's nice to know, but it's not a need to know right now. So what you need to know is that it makes the patient step for about 3 to 5 minutes, gets their heart rate nice and high, and then they're going to compare the heart rate after that every minute to see when it comes back to normal. Okay, and that's really the key, is that the faster that they recover, that means the healthier and more fit that they are. A walk a mile test, Paula just described, it's timed, and it's just, okay, go walk around this track or go walk around this gym as fast as you can. Flat surface evens the playing field, right? Because it makes a difference if there's an incline or not. And we just tell them, you know what, go as fast as you can without being unsteady. And then we just kind of look at how long it took them. Poor fitness levels take longer. That just makes sense. Okay. We also have pedometers, right? Everyone has a Fitbit, everyone has an Apple Watch, and pedometers have really been, in the focus for a long time. But I'm starting to see research that's questioning, where did the 10,000 steps come from? Like, who came up with that number, that 10,000 steps is the number we're supposed to be shooting for? I don't think there was a lot of research that went behind that number. I think it was just a nice round number that that Fitbit or whoever kind of clung to. Your book uses this kind of as a guide, and when I read it the first time, I almost started crying because my goal is 5,000 steps, and that's considered still sedentary. But you guys know how hard it is to get steps in, especially during COVID. So this is just kind of something your book addresses, but I'm not taking a whole lot of stock in pedometers as far as, how many steps you get every day. What it can be useful for is just trending, right? So like, oh, I was more active today than I was yesterday, or, oh, wow, July, I was super active. I need to do some of those activities again in August because it kept me moving more. Does that make sense? It's better to trend than to really diagnose. Any questions on that? All right, keep moving. So now that we know how we can kind of assess someone's fitness, we actually need to talk about how do we prescribe exercise for people. Like, there's actually doctors, physiologists, physical therapists and trainers that will actually prescribe exercise. How do they even start to figure out what to prescribe? So one of the things they look at is a target heart rate. Okay, so what is a target heart rate, Tiffany B?
It refers to the goal for the heart rate during the exercise.
Okay, very good. So target heart rate is the goal, right? Because if we don't hit a target heart rate, we might not be exercising enough, or we might be doing too much. Good job. How do we do a maximum heart rate according to your book? Well, that just says that every age has a different maximum heart rate. And the reason for that is because as we age, we lose capacity to exercise, right? And so we definitely don't want to use the same maximum heart rate for a 30-year-old and a 90-year-old. That would not be good, because the 90-year-old should have a much lower maximum heart rate. So how do we calculate a maximum heart rate? We take 220 and we just subtract the age. So go ahead right now and figure out your maximum heart rate and put it in the chat. Well, we got some youngins in the class. The closer to 220 you are, the younger you are. Sabrina asked me in the chat, how are ECGs performed again? So if they're in a doctor's office, like a quick 12 lead, that uses all 12 leads. But an ambulatory Holter monitor usually uses 3. Okay, so everyone's getting the idea of how to calculate their maximum heart rate. So can someone define what a maximum heart rate is for me? How about you, Mackenzie, have I picked on you yet?
What was the question?
Like, what is your definition of maximum heart rate?
Okay. The highest limit for heart rate during exercise.
Okay, so we really don't ever want to go above that, right? We don't ever want to go above that. Good. Now, how is that different from a target heart rate? How can the target heart rate help determine the adequate amount of exercise? Jessica Doan.
I'm not sure.
Okay, so the maximum heart rate is where we don't want to go above it. So like mine is 170, okay? So I never ever want to get above 170 for any length of time because it's going to stress my heart too much. A target heart rate though is based on a maximum heart rate, but it's taken down to the point where you're not causing injury, but you're strengthening and enduring and, you know, burning fat without causing undue fatigue or injury. Does that make sense? So a target is like a range that you want to kind of stay in to get the best effect from the exercise you're doing. Maximum is you just never want to go above that. Does that make sense? Okay. She's outside too. Lovely, lovely. All right. So what is your maximum heart rate? We already did that. Okay, here's an example. Now, how do we find our target heart rate? Maximum's easy. You just subtract your age from 220. But for target heart rate, you're going to take your patient's maximum heart rate, and you also have to factor in how fit they are. Okay, so if it's a beginner, I would consider myself a beginner exerciser because I don't really get out much. So I would take my target or take my maximum heart rate and just multiply it by 50%. So for a beginner, their target heart rate is really only half of their maximum. If you go much higher than that and you sustain that, you might cause undue fatigue and maybe even injury. Okay, that's the beginner. Someone who's been exercising a while can go up to 70% of their maximum heart rate. Okay, and so in this case, you go from beginner to intermediate, you can go all the way up to 120 beats a minute, and that's safe and effective. And then you've got those crazy people who run miles and miles and miles every day. They, as a competitive athlete, can go all the way up to 85% of their maximum heart rate. So in this case, if I was a competitive athlete, I could aim for like 146 beats per minute sustained while I was exercising. Okay. So get your piece of paper back out. I'm going to tell you about a patient, and I want you to calculate. So you've got a 62-year-old. You need to figure out her maximum heart rate. She actually has been walking and jogging. She's a really healthy 62-year-old. So we would call her an intermediate exerciser. What would her target heart rate be? So I want you to figure out her maximum and her target.
Can you say that one more time, please? I'm sorry.
Yeah, sure. So 62-year-old who does exercise quite a bit. So I want you to find the 62-year-old's maximum heart rate and her intermediate, because that's where she is. She's a pretty good exerciser, her intermediate target heart rate. Okay, so what did you get for her maximum?
Is it 110.6?
58.
58? Okay, 58 is not right. 158?
158.
Okay, I didn't hear the one. Okay, 50 or 158. Yep. So we never want, no matter when she's exercising, we don't want her heart rate to stay above 158 for any length of time. Okay, because then we start to do some damage and we give undue tiredness and maybe muscle problems. Now, what about her target heart rate for an intermediate?
111.
111 or 110 or 112, like right around there, right? Okay, so we're going to tell her, okay, so your maximum heart rate is 158. We never want you to stay above that. Your target heart rate is 111. So when she's on the treadmill with you and she hits 120, what are you going to tell her?
Slow down.
Slow down a little bit. A whole lot, probably not, but a little bit, okay? Let's say she slows down and she's down to 90 now on her heart rate. What do you got to tell her?
Speed up a little bit.
Speed up a little bit. We want her right around that 110, 111, 112 because that's the optimal fat burning, strength increasing range of her heart working at that rate. Make sense? Let me check the chat. I see lots and lots of chat coming along. Okay, they're just the numbers. Good, 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 you guys. I was going to do a heart rate activity with you, but we won't have time for that. That was just literally taking your baseline heart rate, and then I was going to play some music, some soft, slow, relaxing music, and typically heart rates go down. And some pretty gnarly, you know, high impact music, heart rates typically go up. Lots of things affect heart rate, not just exercise. I wanted you to kind of experience that, but I don't want to take the time because we might lose out on our discussion. Okay, any questions up until now? Okay. Let's talk about METs. An MET is a metabolic energy equivalent, okay? Can someone, let's see, Kaylin, what is a metabolic energy equivalent and how can we use it to determine exercise?
Isn't it just like the energy and the oxygen consumed during an exercise?
Good.
Well, activity doesn't really have to be any exercise, but.
Right. Right, any activity. So there's, I can't remember the page number, but there's a box with a bunch of METs listed from high impact all the way up to, you know, sewing and like sleeping or whatever. And what this does is, this is a way to easily gauge someone's activity when you're talking to them. So when you say, if someone tells you, I want to exercise more, well, you can tell them we'll go out and run, but you don't know what they're already doing. So it's really good to know, oh, I want to increase my exercise more. Well, what do you do for fun? What do you do for exercise? Well, I sew. Okay, so we're going to probably go up the scale a little bit, not a whole lot, right? We're not going to have a sewer go and run now, right? We're going to build them slowly. So you're right, that's exactly what it is. It's the amount of energy needed during an activity. So which has a higher MET according to your book, Alyssa? Bowling, moving heavy furniture, or sewing?
Moving heavy furniture.
Okay, good. So now if this person comes to you and says, I really want to increase my activity level during the day, and you say, well, what do you do for a living? And he says, I move furniture for a living. What are the activities that are higher on the MET scale that you could suggest to him? Anybody?
Playing basketball.
Okay, yeah, getting scrappy on the court, right? Or running, or some of the other things that are higher on that list. Any questions about METs? They're just an easy way to kind of gauge people's activity level and an easy way to kind of increase their activity slowly. Okay, I'm going to take silence as no ma'am. All right. Okay, actually, well, we've only been at it for a half hour. We're cranking through. Let's talk about types of exercise. So there's fitness exercise and then there's therapeutic exercise, okay? As a nurse, you're not going to worry much about fitness exercise, honestly. We're going to be worried about therapeutic exercise. So what is fitness exercise, Sabrina?
Sorry, I was using the restroom. Fitness exercise is cardiovascular conditioning regarding strength and resistance.
Right. So that's what, you know, healthy people do. They're the ones who say, I want to join a gym, or I'm going to go out and start walking, or I've got some weights in the basement. That's what physical exercise is. Healthy people do it to improve their health. Okay. So now there's ways to do fitness exercise. One is isotonic. So isotonic exercise, I'm just going to tell you because these will kind of get blurry until I explain them for you. Isotonic exercise is movement and work at a target heart rate. Okay, so you're moving and you're working at a target heart rate. And it's usually more cardiovascular in nature. So walking and running are good examples of isotonic exercise. Okay. If someone's not really in tune to taking their target heart rate all the time, a good way to teach them, like, I think you'll be okay, is if you can still talk during your exercise. You're not doing too much if you can still carry on a conversation. Okay. It increases cardiovascular conditioning and makes your heart a lot stronger. Walking and jogging, like I said, are good examples of that. Okay. Your book says that it elongates the muscles. So if you think about someone walking, going from one step to the other, one foot to the other, some of those muscles are really being stretched as you take that step. And then when you take the other step, the other leg stretches and your back stretches. That's more of an isotonic muscle movement, that stretching. Okay. So isotonic is all about cardiovascular conditioning and endurance building. Now, conversely, isometric exercises don't really work on endurance so much. They work on muscle. Okay. They're usually a stationary exercise, which doesn't mean you're writing letters on stationary, but it means you're not out running or covering lots of ground usually. Okay. They're usually standing in place, sitting in place. Working to hold a position is a type of isometric, so like Pilates and yoga. Also weightlifting, okay, using resistance. Isometric increases muscle mass and strength. And the way I remember it, because I always need some way to cheat sheet myself into remembering stuff, when you have a bicep muscle growing, you can measure that. And how do we measure things? In the metric system, right? So isometric increases muscle. That's how I remember it. Kegel exercises, that's, where we try to have incontinent women strengthen their pelvic floors so they can start and stop their urine stream. And that tightening up of those abdominal muscles and releasing them, those are called Kegels. And that's another form of holding a position or, building muscle strength in that area. Okay, so weightlifting is an isometric. Any questions on that? I've got a video. It's just a funny video of people trying to lift weights and falling over and stuff. I won't play it, but sometimes if I can't get people engaged, I'll play it. But really, this is easy. As long as you remember metric, you can measure the muscles as they're growing. Now, here's the kicker. There's a third one, isokinetic. Now, isokinetic is really just a blend of the two. Okay. So it combines movement of isotonic and the resistance of isometric. So you're doing two things. You're conditioning the heart and you're building muscle. Okay. Usually this is with the help of a machine or maybe some weights. Okay. It's because you need that resistance part. An elliptical is a good example of that. If you crank down on that big wheel thing and you create some resistance, now you're doing isotonic because you're building some cardiovascular, but you're also building muscle with the resistance that you're pedaling against. I do want you to see this video because it takes a little bit to figure out why. This is an isokinetic. Let's see. I think it's this one. Nope. This one. Nope. This one. There we go. Okay. So when someone figures out why this is isokinetic, I want you to yell it out. You actually don't need the sound, but I'll turn it on just for fun. Why is this isokinetic and not just isotonic?
Because she has weights on her ankles.
Open up that door and walk right in my heart. Come on in. Professor Punky, I have a question.
Yeah.
Okay, I know we haven't seen the video, but was it because she had weights on her ankles?
Yeah, did you already see it?
No, I noticed it in the picture.
Gotcha, yeah. So let's pop it open now that I found it. I must have bumped something and it pulled up another one. But yeah, it is because she's got weights on her ankles or on her wrists or wherever, and that creates resistance along with the movement. Technology is great when it works. Okay, here we go. Right, so she's moving, and if she didn't have the weight and ankle weights, then it would just be isotonic, right? But since we're adding some resistance by building some calf and thigh muscle, we're going to call it isokinetic, and I'm going to call it.
I hear a bunch of music.
Say that again?
I didn't hear what you were saying. I was hearing like a bunch of music.
Oh, okay. I was just saying that the fact that she has those ankle weights on turns her exercise from isotonic to isokinetic, because those ankle weights are going to build some muscle mass.
All we can see is a picture of a house. Oh, now I can see you.
All right, forget it. Technology at its best. Okay, let's keep moving. Then we're going to take a break because I need to get up and shake. All right. So now that all of that is kind of, you know, the stuff we would go out and do just to maintain or improve our health. But there's also something called therapeutic exercise. So Mandy, can you tell me what therapeutic exercise is?
Yes, it is activity performed by people with health risks of those being treated for an existing health problem, such as like cardiac surgeries.
Okay, so this isn't like for you and me who just want to get healthier. This is for someone who maybe has a disease process or who's rehabilitating from something that made them, you know, lose their stamina and their fitness level. And so this is more rehabilitative, okay, therapeutic exercise. So this is more prescriptive from a healthcare provider, more so than a gym trainer, okay? It prevents complications or it restores function. So describe active exercise and give me an example. So let's say that an active exercise, let's think back to your CNA training. We're going to really think about range of motion exercises for the rest of this lecture. So active is performed independently, right? If you did active exercise, range of motion with your patients, you would tell them how to do it or maybe demonstrate it, and then they would use their own muscles and their own willpower and their own strengths to do what they were told, right? Has anyone done active range of motion with people? Anybody?
I have.
Perfect. Okay. Now, conversely, passive exercise, now that's where the patient really doesn't have any control or strength to do the exercise you're telling them, and you are literally lifting that body part and moving that body part through the activity for them and with them, because they don't have the strength or the ability to do it. Okay, so it's performed with assistance. Why are range of motion exercises performed? There's a bunch of reasons why we do range of motion. Eden, can you tell me some?
To help them get kind of back their ability to do things.
Good.
To keep them from like stiffening up or not being able to use that part of their body.
Good. Yeah, those are two big ones. Let's look at my list. It's a little bit more inclusive, but yeah, it definitely has those. So joint flexibility assessment. So when you're doing health assessments on each other and you're doing musculoskeletal, you actually run their joints through their range of motion to make sure that they have full range of motion and not restricted or partial range of motion. So it can be an assessment. It can also be to maintain that joint flexibility, right? And that's what you're saying, Eden, is you don't want them, you know, losing that flexibility. So we do passive or active range of motion to maintain it. We also do that to prevent any loss or joint movement. So, you know, stiffening contractures. And we also go back to the permanent loss. That permanent loss of a joint flexibility is called ankylosis. You'll find that in your book. Another thing we use range of motion for is just to stretch before strenuous activities. We do that hopefully before we exercise in the fitness world too, not just the therapeutic world. And to evaluate response to an exercise program. Now this sounds weird, but let me explain it to you. Let's say that we realize that someone's wrist is pretty contractured from being in bed and being neglected. So we start out by assessing that range of motion and we find it very limited. And we kind of take note of where you can stretch that joint. Then let's say you do some range of motion with her and you do 10 reps trying to stretch that out. Then at the end of that, you can reassess to see the response, to see if what you did made a difference. So you can use it to assess the flexibility or to reassess after an intervention, like doing some range of motion with them. Okay. I think we need to take a break because my throat's sore and dry and I want to go get a drink. So why don't we come back? What time is it? Why don't we come back at 2 and we'll continue?
Miss Professor Bunky.
Yeah.
We can take this thing off now or no?
What, your ostomies? Yeah. Did everyone show me?
I did, but I'll show you mine so I can
All
take
right.
it off.
Everybody show me and then get them off.
Can you see it?
Oh yeah. Look at all that pudding. Look at all that pudding. All right, go take them off. Go get cleaned up, and no pudding for lunch.
Mom, that's pudding.
Oh, shit. Yeah, that was pudding that we had to do.
I'll see you back at 2.
Can we eat some?
That it's something that moves, let's say, the arm for somebody, like a machine that does it for them.
Okay, good. They can be armed, so it's a machine, and it's described pretty good in your book. It's a machine that's electronic, right? So it's electrical, and it does the work of like a nurse or a PT that would be doing passive range of motion for somebody. It's a substitute for that. And I'll give you an example. So I think I told you that my sister had a knee replacement, and when she got out of surgery, they put her in one of these machines, and it just moved her knee, straightened her leg and put it back, pulled it back and pushed it forward, pulled it back and pushed it forward, really slow. That kept the joint from swelling, and it kept the joint from getting kind of frozen, and it helped with healing and pain. Okay, so that I've also seen them for like shoulders. Those are the two big joints I've seen CPM machines for. The benefits, like I said, it increases range of motion and the flexibility of the joint. It decreases blood clot formation, because an area of the body that doesn't move and if the muscles don't contract, you can form blood clots because the blood isn't being squeezed back to the heart. So the CPM machine actually helps venous circulation back to the heart, and it accelerates that joint healing, and also it helps with pain. And I don't think it says that on your screen, but it does help with pain. It's most often used for post-op rehab, like after a joint replacement or after a joint fix of some sort. Okay, so that's the CPM machine. There's pictures in your book. I would read about that.
Professor Punky, is that machine called something else besides that?
CPM.
Like,
no.
Okay, maybe it's just abbreviation of it.
What are you thinking?
Because I worked on the ortho-neurofloor at Proctor, so I thought it was another name for the machine, but I think it's just the abbreviation of the machine.
Yeah,
Yeah.
CPM. Yeah. Or it might have been the brand. You know, maybe they're calling it by the brand name. I'm not sure. So what are some items to include in a patient teaching regarding safe exercise? Okay, so where are we at the top of the list? I think, Carly, what would you teach someone about a safe exercise program?
I don't have anything written down, but I like safe shoes.
Okay. Yeah, shoes for sure. Yep. Shoes will make you or break you, right? So table 24-1 has all of those. So it's like exercise with a partner, you know, learn about their target heart rate, all those kinds of things. So you'll want to review that. What are some gerontologic considerations? So what do we how do we teach the older people differently? Like what are some things we're worried about with older people starting to exercise, Blaze?
Well, for older people, I would need to consider any joint deterioration, any prior injuries, having an expectation that their heart rate goal is going to be that much lower, so not jumping directly into something else and assessing as it needs to happen, as well as any other medical conditions which can prevent our exercises, I guess.
Excellent. Also, with the elderly, especially, we worry about hydration because they can dehydrate pretty easily with increased activity. You know, gravity really hurts their joints, so maybe exercising in water, you know, water aerobics is very helpful for the elderly. So just some other thoughts about gerontologic. There's actually a little blurb on page 544 you should probably peek at while you're studying, you guys. Okay. What are some guidelines for performing range of motion exercises? Like what are some rules that we should be following, Tiffany Irby, when we start doing range of motion on people?
You will want to watch how you helping them, making sure that you're not hurting them, and watch out for the stretch, watch out for the turns, and more just like the teaching as you're going. So basically the safety of the patient.
Good. Yeah, everything we do has to have safety in mind, right? So using good body mechanics for them and for us. So, you know, if you're going to lift a heavy leg of maybe a 300-pound guy, you need to use good body mechanics before you start doing passive range of motion on them, right? So we need to like have a wide base for our stance, lift with our legs, not our back, those kinds of things, okay? So that's super important. Remove clutter from the area is huge because, you know, these especially these nursing home rooms, they're tiny and they usually have a lot in them. So you need to make sure you're safe. You're not trying to work around a bunch of stuff on the floor. You also want to position yourself to facilitate the movement. And what this really means, just practically, picture you need to do range of motion on someone's upper arm. Well, you don't want to be behind them doing that, right? You want to be in front of them or to the side of them, wherever it can facilitate their movement the best, so you're not stretching over them or awkward in your movements. Repetitive patterns. So this is where, you know, when we do range of motion, we don't just do it once. We'll do like a rep of 10, right? And we will do a similar movement with each extremity and each joint. The best nursing homes that I have seen they train their CNAs that every time they're in the room, whether they go in for a morning check and then a mid-morning check and then some vitals or some turning or some pottying, whenever they're in the room, they should be doing some sort of range of motion before they leave on a different joint. So oftentimes they would start at the neck, and then, you know, the next time they're in, they'll do shoulders, and the next time they go in, they'll do hands and elbows, right? And if we can do that every day, that'll keep that joint flexibility and some of that muscle strength, you know, from deteriorating. And then support the exercised joint. This is important too. So if I'm telling someone to work on their wrist, I'm going to support their arm for them because they might not be able to lift this arm while they're doing this, right? If we're focused on this, we need to support that for them. So that's another thing, is just support when you can. Move until resistance, not pain. So Tiffany Irby, or Turby, I guess I called you, I was shortening it, mentioned we don't want to hurt them. So move until resistance, not pain. You'll feel when they start to tighten up. That's when you stop. You don't wait until they scream or take a deep breath in or flinch or pull away. Some other things, watch for those nonverbal cues of discomfort where they're grimacing or they're sad. You know, you'll see nonverbal cues. Our older people don't want to be insulting, and they don't want to act like they're not cooperating. So a lot of times they will not tell you if you're hurting them. So we need to be alert to that. Avoid a painful joint. So if Mr. Smith bumped his elbow going through his doorway and it's red and swollen, we're going to pass on range of motion on that joint today, right? And we don't want to make him hurt more or do more damage. Stop if spasticity appears. So spasticity just means you get it to a certain point and it starts trembling, right? That means you're going too far. You should stop at that point and not push it. And here's a biggie, you know, when we're working, even just passive range of motion, some people are so declined in their cardiovascular endurance that they may actually have vital sign changes just from us doing passive range of motion, because it's actually taking some cardiac endurance to do that and to sustain that and to tolerate that. So realize that their heart rate will go up while you're working with them. Their respirations will go up, but they should return to baseline when you're done, right? Kind of like that step test. They should return back to normal. And the best thing you can do for family and nurse long-term care situations is teach them how to do some range of motion with their loved one. I always go back to my mom. She was in an Alzheimer's wing, and she was non-communicative for quite a while, didn't recognize me. And when I would visit her, it was awkward, right? You just kind of stare at each other. But when I remembered, oh, I can do range of motion with her, that was a way that I could help her, plus, you know, interact with her and be with her, but it wasn't just staring at her. So it is perfectly fine to teach family members and loved ones how to help their residents do range of motion. Okay, so I'm going to stop sharing. I am going to get rid of that spotlight because I hate it. Now, I'm seeing all of you. We're going to do range of motion, and since you don't have a partner, like back in the day, we were in a classroom, we would just partner up, but we're going to do range of motion on ourselves, okay? We're going to start at our head and work all the way down the joints that we own. So right now, it would be the neck. How does your neck move? Like, okay, so we're looking side to side. So we would do 10 of those side to side with a little stretch. We're going to go nice and slow. It actually feels really good after being on a computer all day. How about looking back and forward? We would do 10 of those with our patient. How about the round? That feels really good. Okay. Once we got done with their neck, we would move to their shoulders. We can have them shrug. We can have them do some circummoral kind of circles. We can have them rotate. We can have them go forward and back, up and down. Lots of range of motion with the shoulders. We can do elbows, right? So we can do out and in. We can even have them pronate and supinate, which is kind of putting their palms up and down. Our elbows do that. Then you can move down to the wrists and work them really good. Stretch them up and down and around. Fingers, that feels really good to someone with arthritis. Do range of motion with their fingers. Okay. Then we can move down their spine. You can actually have them bend over with your help and stand up, or they can twist. I always get a few cracks and pops when I twist. You can do hips. You can do knees, you can do wrists, or not wrists, ankles, and you can do toes even with them. You have no idea how good that feels to someone who can't do it for themselves, who's just stuck sitting or stuck laying. They get very stiff very easily, and that stretching feels so good to them, okay? Let's see, I think that might have been my last slide. Let's make sure we did neck, shoulders, elbows, wrists, fingers, thumbs, hips, knees, ankles, toes. That almost sounds like a kid's song. Head, shoulders, knees, toes. Okay. Questions? We just covered a lot. Sky's still working on her shoulders. Miranda, is your hand up?
Yeah, so I have somebody that I take care of, and like a couple of their fingers are pretty bent in, you know, and they move like a little bit. So like if you were taking care of them, would you stretch those or would you just skip those?
No, I would definitely work on them. Now I wouldn't make them go farther than she's able or he's able, but I would definitely work, because even if you don't get them farther, you'll still maintain what she has, right? There was one lady who had really bad arthritis, and whenever she would come up for her med pass at the nursing home, I would always go, okay, before I give you your pills, you know, you do this with your hands, you know, 10 times, and then I'll give you your pills. And it would remind her that she needed to do that. I think that would be great. Also, soaking them in warm water, Miranda, might loosen them before you start working with them, right, to relax those muscles and tendons. Absolutely. We always want to maintain what they have, even if it's a little bit. Good question. Anybody else? Yep. All right, I don't see any other questions. Okay, so I'm going to put you into groups, and we're going to do more of a practical activity. It's a case study. It's in Blackboard in today's folder, and it's a case study about Mr. Tilley and his story, and it focuses on activity and exercise. And I'm going to put you in small groups to get to know each other a little bit more and to work through this case study. My challenge is that someone actually pull the case study up and share it on your screen. Like, I want you guys to learn some techie stuff while you're in here too. So I'll put you in groups of 3 or 4. One person will pull it up on their screen. You can read it out loud and just work through the questions together, okay? It just gives you like a patient space along with everything we're learning today. I just don't ever want it to just be a bunch of words or rules. Okay?
What's the case study?
Wait, what?
I was asking what the case study is called. Is it the mobility one we're going over?
No, we're not in the case study. It's actually loaded. It's a case study, but it's one I gave you. It's not in Evolve. So it's in Blackboard. It's a Word document in today's theory folder. So Friday's folder at the bottom, it should say like small group activity case study.
When I do it, it's just your PowerPoint that pops up.
Did I upload the wrong thing?
Yeah.
Oh my golly. Okay. Give me 5 minutes and I'll fix it. It's Friday. All right, it should be there now. Like, refresh your Blackboard and it should be there. I'm sorry. It's been a day. Does that look better? It's a document. Okay, so I'm going to put you in small groups. I'll bop in and out to check on you. Use your chat bar if you need me, okay? But you're just going to get to meet some new people right now. How fun is that? Okay, here we go. I'll see you guys in a little bit. Actually, it's 2:20. Let's be done by 2:45 with this, okay?